reimagined health system, in my opinion, is one that does not rely on out-of-pocket expenditure, external financing, and is one in which public finance management is operating efficiently. Funds are predictable, they're adequate, and they get to the front lines. So it's not just about having money, but it's about how that money gets to the front lines and translates into actual services for our people. The global health architecture for financing has changed. External donor financing is reducing. So it comes at a time when leaders have to understand that it's time for leaders to make difficult decisions to ensure that health systems receive predictable, adequate financing for our health systems. And in order to do that, we need to be able to make sure that right from the way we raise finances for domestic revenue, to the pooling, to the way we purchase services, is well organized. One of the most critical issues here is that we need to translate not just additional financing, but the current financing into tangible, impactful health services. So it's not just about additional money, it's about making sure even the little that we have is making the right impact for us to move towards universal health coverage. Our populations are counting on you as our leaders to make the right decisions. So during the World Health Summit, health financing is central. And that's typically because a lot of the health service delivery requirements require financing. So if you think about health workers from communities right up to specialized services, infrastructure, equipment, commodities, central theme is obviously health financing. But what is, I think, critical at this moment in time is that Africa is moving towards an era of self-sustainability and sovereignty. So we need to think about how best we mobilize more domestic revenue. We make sure that revenue is translated into services. And I think that as we come to the World Health Summit, a lot of the sessions that have been put here require us to actually contribute to reimagining and innovating within our available resources.